I did want to come. This is obviously the first meeting that I've had with any group, and maybe one of our last great hopes of trying to fully fund our general fund. And as you know, I made an announcement yesterday by video, and we chose to do it that method because I think it got the best response. We're going to continue to do things a little differently with the press, and so this is one of the ways that we're doing that. You know, since I've been governor, just like with y'all, we've dealt with this crisis every year. When I was in the legislature, we dealt with the crisis, funding the general fund, particularly funding Medicaid. But it's all the essential services of government. It's not just Medicaid. It's our law enforcement, it's our mental health issues, it's anything that the general fund covers other than education. And it's been a problem for years. When I was in the legislature, the last few years I was in the legislature, we covered it all up with stimulus dollars because we had $4 billion of stimulus money that came in, and so we didn't think as much about it then because we just poured money into it because we had money available. But when I became governor, we didn't have any money left. And so every year this has been a difficult situation that we've had to deal with. One of the things that I did, and all of you know this, one of the things that I did when I came in, we tried to make government more efficient, and we did that with Medicaid, and Don helped tremendously with that, and we made, at least we began to understand how Medicaid actually worked, because up to that point nobody ever really knew. And Don helped us tremendously with that. So we worked on efficiencies. We tried to make government more streamlined, and we've done that. And in fact, we try to continue to remind people that we've saved the state of Alabama $1 billion a year with those efficiencies. Now, I don't know where we would be if we had to pay that $1 billion. But we would really be in dire straits. But we still are in dire straits, especially with our general fund. So we've cut, we've made it more efficient. We've offered some fair tax packages that our legislative group decided that that was not the answer, and we were able to get some. We were able to reform the way we budget to a certain degree, but not as much as we should. And we were also able to pass a very modest amount of taxes last year, but that took a pound of flesh and a pint of blood that we're not able to give this year. So we have come to the conclusion, I've come to the conclusion that if we're going to, as best we can, fully fund the general fund, we really don't have but one option. Now, I described the lottery in the past as a leisure suit. And those of you who are as old as I am, I never owned a leisure suit, tell you the truth, but some of you did. And some of you wore it, and you wore your hair a little bit longer. And so I always described the lottery as a leisure suit. It was somewhat outdated because everyone around already had one. The states around had it, and you know, and so we may not be able to get as much from it as some of the other states because some of the best customers in the other states are Alabamians. So we actually already have a lottery in this state. We just don't get anything for it. We don't get anything from it. And that is not necessarily my first choice. It really is not. The truth is, though, it's about the only choice that we have left. And so we're going to push that. We're going to push a very simple lottery that allows the people to vote on it, whether or not they want it or not. And I've been asked this since I've been in office. Governor, when are you going to let us at least vote on it? Well, the legislature has to decide this, but I have to push it. And, you know, I'm the one that will be out there in front on this, trying to get the people of this state to get the legislature, get their legislators, their representatives and their senators to allow them to vote on this particular issue. We can get $225 million to $300 million a year out of a lottery. I really want it to be simple. The more you complicate things in the legislature, the greater chance is that you'll have failure. And so we're going to put forward in our call, we will make it very narrow. It will be a very simple lottery, and it really will be just a constitutional amendment to let the people of Alabama vote to decide if they wish to have a lottery that will have very good oversight with reputable people, so that we will make sure this is run the way it should be run. Now, $225 million to $300 million, especially if most of that goes to Medicaid, even though some of it needs to go into law enforcement, and it needs to go into some other areas of our general fund. And I personally would like to see our state employees who haven't had any kind of raise in about 8 years, I'd like to get them a little raise. So, but most of the money, I believe, should go to Medicaid, because that's where our primary problem is right now. You know, the lottery, though, is just a means to an end. You know, last Saturday, or Saturday before last, there's a church in Alabama. It's the largest church in Alabama, in fact. It's the Church of the Highlands. Some of y'all may go to the Church of the Highlands. They had Serve Day, and they sent out 22,000 people to serve, to paint houses, to cut grass, to do the things for the people that needed some help. So what they did is they did this. The pastor, before they went out, he had a prayer. And the prayer was that everyone realized that they were not going out to cut grass or to scrape driveways or to scrape houses or to fix fences. They were going out, that was a means to an end. And that end was that they were helping people, and they were loving people, and they were showing God's love through what they were doing for them. Now, the lottery is not the end. The lottery is just a means to the end. The end is what y'all do every day in your hospital out there, and that's to help people who are hurting. That's to help people who are in need. That's to help people who come to the hospital and they're anxious and they're afraid, and it is a ministry. What y'all do is a ministry. And let me tell you, everything that we do in this state and everything that I've done as governor, it's based on caring for people and taking care of people. I didn't come into this job for any other reason. I didn't come into this job obviously to make money. And that is so foreign to me that it's hard to even believe that anybody would try to come into a public service job to try to make money. Now, you have to make a living. I know some people may need it more than I do, even though I do need it. But I didn't come into this for this reason. I came into this to help people. And I want to say this. There are hurting people in this state. And we have 1 million people in this state who are dependent on Medicaid. Your hospitals are dependent on Medicaid. I'm not saying that's the best system out there. I'm not saying that Medicaid is the way we ought to do things, but folks, it's the only thing we got. So what we have to do is use what we have. I am not comfortable in any way to think of the fact that 500,000 children are born into poverty in this state, and that 500,000 children may not get quality health care and may not grow strong and healthy because they cannot get quality health care. And I'm not comfortable with that, and that is unacceptable. And you know, if we don't try to do something like I want to try now, and this is a means to an end, but the end is always people. The means is the lottery, but the end is helping people. And that's what I want to do. And I know that's what y'all want to do. So I need y'all's help. I need the people of Alabama's help. I need for them to tell their legislators that they need to vote on it. And if it passes, then we will put in place with some enabling legislation, we will put a very clean lottery that is ethical, that no one's making money off of, that we can really help the people of our state. It not only will help our children, it'll help our disabled people, it'll help pregnant women, it will help those that are in nursing homes, our elderly, but also, as I've said, it'll help our law enforcement. And you know what? Law enforcement needs help right now. They need support. So we need to look at Alabama as a whole and see how that we can help this great state. And it is a great state because we have the greatest people in the world. And I love the people of this state. And I want to continue to work hard to try to come up with a solution. This is the best option that we got available right now. And so maybe it is a leisure suit, but it might be the only suit that you got in your closet. And so you got to wear something. And so let's just take it out, wash it, dust it off, let your hair grow a little bit, and let's try to get this through. And so I need your help. I need your support. You may not be for a lottery, but you are for helping children. That's me. I may not be for a lottery. I may not think this is the best way to do it, but I care, and I've weighed this, and I've prayed about this. I have weighed this. Which is worse? A lottery or denying people the right to have some type of health care out there? Which is worse? Well, I think it's worse because I can tell you, as a Christian, I have read the Bible a number of times, and it is full of talking about helping the poor. I don't see anything about the lottery, but I can tell you it's full of helping the poor. And I can tell you we have got to help the people of this state. And this is a legal means to do it. We already have a lottery in this state. Why should we be supporting Georgia and Tennessee and Florida? Mississippi doesn't have one, but they have casino gaming. Why should we help them shore up their budgets when ours is in dire straits? So I came to you today. This is the first group I've spoken to. I'm going to be at UAB on Monday. We're going to travel around the state, and I'll be in your areas. I may come to your hospitals because I think that's the emphasis right now. I think the main emphasis ought to be related to health care, even though there are other things, as I've already said. So please help me. Please, whether or not you're for a lottery or not, don't think of it as a lottery. Think of it as helping the poor and helping children and helping people that are truly in need.